Hello, I'm Dr. Tokala Surender Reddy, Senior Consultant General Laparoscopic and Bariatric Surgeon working for Yashoda hospitals. Today, we will discuss and we will talk about the hemorrhoids, the piles disease, which is very rare and a disease with annoying complaints and many myths and doubts and apprehensions in the patient population. So today I would like to answer the Google questions, frequently asked questions regarding piles disease. When do piles require surgery? As piles are graded into 4, grade 1, grade 2 and grade 3 and grade 4. So depending on the grades, we advise the patient's surgery. When patients come with complaints of bleeding per annum, that is bleeding from the anal orifice while they pass stools, and when they'll have severe pain post defecation, and when there are pile masses coming out of the anal orifice, that we call it as grade 3, where patient himself pushes them inside, and grade 4, where the piles they come out and they don't go in. We call them as grade 4. So from grade 2 to grade 4, they all require surgery. A patient having anemia, that is blood loss, and a decreased hemoglobin count, also they require correction of the hemoglobin, and then subsequently we need to stop with the one or the other surgical modality and of the bleeding piles. Coming to the second question, it is how can piles be treated? Again, depending on the grading of piles, that is classification of piles, what is grade 1, grade 2, grade 3 and grade 4. So grade 1 as such, only symptomatic relief and lifestyle modification, that is diet, change of defecatory habits will suffice. Whereas grade 2 to grade 4, they do require, when they have severe bleeding per rectum and severe constipation and something masses coming out of the rectum, they all have to be treated initially grade 1 with the medical management and lifestyle modification. Grade 2, 3, 4 have to be dealt surgically. Is piles surgery painful? Yes, as anal orifice anal region is very sensitive. There is some amount of pain depending on the modalities. Conventional hemorrhoidectomy surgery, we call it as medically, that is surgically cutting and removing the pile masses, is definitely very painful. Whereas coming to the latest modalities like laser and hemorrhoidal staplers, these are less pain, but there is mild pain and discomfort in the anal region for a few days. Subsequently, they do well with medication. Can I sit after pile surgery? Yes. This is a question which is frequently asked because it is the bottom on which everybody sits, and you operate in that area, and prolonged sitting should be avoided. They can sit, and in laser surgery, as the pain is less, they can sit comfortably with mild medication. Whereas conventional hemorrhoidectomy surgery and also stapler hemorrhoidectomy, where one supposed to take some rest, and prolonged sitting should be avoided. Whatever is the modality of surgery, prolonged sitting in the initial period, that is at least in the first week of surgery, prolonged sitting should be avoided, because that can cause pooling in the operative area and they can give lots of pain, and sometimes in conventional hemorrhoidic surgery they can have bleeding also. How long is recovery from pile surgery? Yes, definitely the recovery from the pile surgery, it depends again on the modality of surgical management. That is, whether it is conventional hemorrhoidectomy, or it is a laser surgery, or it is stapler hemorrhoidectomy. Conventional hemorrhoidectomy surgery at least require a week of rest, whereas laser and stapler hemorrhoidectomy, they can go back to work after 3 to 4 days of surgery. So the best is the laser surgery, where if a grade 2 piles is operated or grade 3 piles, masses which are dealt with, they can go back to work within a day or two. Can hemorrhoids be removed without surgery? No. This is a myth. They cannot be removed without surgery. Some quacks, they do put advertisements here and there in public places saying treatment of hemorrhoids without surgery, which is wrong. Once they go there, they also do some cutting and putting threads and all those things, which, many patients, they come back with lots and lots of complications. Sometimes I have seen in my 25 years of my surgical experience, I have seen patients coming with lots of sepsis, and sometimes, they come in a very bad shape. So there is nothing like hemorrhoids removal without surgery. That's a myth. That's not correct. Yeah, thank you very much. Namaste, namaskaram for hearing to me regarding the commonest problem which all the male and irrespective of gender, male and female, they suffer with, that is hemorrhoids illness. Definitely, we will be helpful to you in Yashoda Hospital, where we give quality treatment with care and compassion. Namaskar.